How you doing? It's Jesse. I'm back at my favorite place on earth, Chrysalis Rejuvenation Clinic, and today I'm getting CoolSculpting! Oh yeah, the Quarantine 15's got nothing on me. We are gonna freeze this fat. Let's go inside. Okay, here we go. CoolSculpting at Chrysalis Rejuvenation Clinic. You have no idea how excited I am. Now, before we start, I know a lot of people are gonna say, oh my God, you don't even need it. But I have Cassie here to back me up that CoolSculpting is actually for people who are generally in shape or thin and just have stubborn problem areas they want to get rid of.
That's true, yeah. Actually, it's designed for people that are not overweight, but just have those little pockets that they can't seem to shape.
Yeah. Here we go. No, you can't see my bum. She covered it with a towel. So what do you have there, Cassie?
So this is a pre-treatment wipe. So it is anti-freeze, essentially. It stops the skin from freezing, and we also put another protective layer. So the skin, there's no effect on the skin from CoolSculpting. And fat cells freeze faster than the skin cells anyways. So
woohoo!
It's easy.
So yes, I'm doing my love handles. You know I like my wine.
You just want a second CoolSculpting machine.
A second CoolSculpting machine.
So we can get your flanks done in half the time.
Oh, because you need too much. My flanks. Ugh. Yeah, well, cool technology makes sense to me. All the Real Housewives do that, like, cryotherapy now, you know, where you go. So I'm like, obviously, you know, cold destroys fat cells.
It does. It works. It's easy. It's smooth, too. There's never any, when it's applied properly, there's really not a lot of undesirable outcome with CoolSculpting. So we're really happy with it.
Now, is it possible to overdo it and, like, take away too much fat?
Yes.
Oh.
So if we have patients like yourself, we would recommend that you wait the full 3 months to see absolutely all the results you're going to see before we decide to retreat you. Because, yeah, if you were a hyper responder or if you're somebody that doesn't have a lot of body fat, we want to make sure that we're not treating into areas that don't need it. But we make that decision when we see the patient.
See what happens. Everyone's different, right?
You can't put it back. Once the cells are killed by the cold, they never replace.
So it's like lipo in that way. Once you remove the fat cells, that's it. So you're going to gain weight in other areas.
Well, the fat cells that you still have in the area can always increase or decrease in size. But once you kill a fat cell, you kill it for good. And after adolescence, you don't produce any more fat cells.
Excellent.
This is the gel pad. So it's a slimy pad that goes on, extra protection for the skin.
Woohoo! That's cold.
Yeah, it's cold. It's gonna even get even colder for you.
It's okay. You know I can take the pain.
Yeah, I wouldn't consider it a really painful treatment. When we remove the applicator, we do a manual massage, we call it. That's kind of a loose term for it, but a manual manipulation of the tissue. So any fat cells that were maybe on the verge of death when we removed the applicator and thought that they were going to live, the manual manipulation helps to kill them off. So just for maximum benefit. Yeah, maximum. This is the applicator.
Oh,
So there's different contours that can go on. This is the curved one, so we most often use this on flanks where we have to go around a section. There's flat ones where we can do arm or inner thighs. And then there's one that has a little bit less of a curve for the abdomen, which you'll see when we do your abdomen.
Spoiler alert. They need to invent like just a whole body one.
Yeah.
That'd be cool.
That you can walk into.
Yeah, right. Like one of those medieval, you know.
What about your butt?
Yeah. Okay, here we go. Oh.
Jesse's almost too small for the CoolSculpting applicator that we're using.
I felt that. It like sucks on.
Yeah. It needs to be perfectly coupled with the tissue so that the tissue is going in, sort of bottoming out the cup here. So sometimes when we have patients that are smaller, it is a little bit more difficult, but it looks like we've got a good grab.
We'll be back. I'm gonna go lose weight. Can you just hit stop? Okay, I'm almost cooked. It's been 30 minutes. Cassie, what's the most commonly treated area with CoolSculpting?
This area right here, the flanks and the abdomen. Those are the most popular areas. And then the next would be underneath the chin. That's an area that we can treat anybody. So even if somebody is overweight and they might not be a candidate for CoolSculpting on the body, we can almost always do the chin, and it makes a huge difference.
Okay, sign me up. Oh, that felt weird coming off. It's like I wasn't expecting how high the suction is as well as the cold.
Yeah, the suction is strong.
So a reason people should come for a free consultation is because I imagine the cost varies greatly depending on what you need done.
So we can't really give somebody pricing over the phone. We really have to see them.
Yeah.
Because even if you might weigh the same, you might be the same height as somebody else, but yeah.
So she's massaging me right now.
Massage.
It tickles a lot.
Yes. It tickle hurts, eh?
It tickle hurts. Ooh, I was expecting this.
Yeah, this area is hard for that.
So this is breaking up the fat?
Yeah, this is helping to kill off any fats.
And so then it takes several months for your body to absorb this liquefied fat, sort of?
Exactly. You process it through your lymphatic system, so 1 to 3 months. It's different for everybody. Like some patients see, majority of results in 1 month, and then the next 2 months are like a little bit more, and then some patients are really, really gradual. So we follow up at 2 months, and then we follow up at 3 months for photos. And you can see the difference. I don't usually do a follow-up at 1 month because there might not be a lot of results.
Yeah. Woo! Look how red that is.
Yeah.
Wow.
And it's quite it feels like a frozen, like a slushy almost.
Gross. Ooh, here we go again. Oh, this is the weirdest feeling.
I know, it's pinch tickling. I hate pinch tickling. They've done studies on massage versus no massage, and the results they've concluded are 68% better with the massage.
With a massage.
So there's really no option. Like you
Gotta do it.
Woo!
You feel it now, like the blood's coming back into the area.
Yeah, sometimes
It feels
for a couple of minutes you can feel the
burny almost.
yeah. Right.
One area down.